Our worlds were completely turned upside down as we knew it.
This is stage 4 cancer. It's spread to your liver.
My entire liver was covered with tumors.
And at that point he said, you probably have about a year to live.
It was a complete shock.
I felt like that's not, there has to be more that we can do.
My name's Jessica Delaney Sloper. I reside in Scarborough, Maine with my husband Ryan and my 3 daughters.
My name is Kevin Demoskoff. I live here in Sherwood, Oregon. Me and my wife Rochelle have 3 kids. The first time that I noticed any symptoms, I actually just got a really sharp pain in my upper abdomen. After being in the ER, I was referred to a GI specialist.
Christmas night of 2020, I did notice blood in my stool, which prompted me to go and seek care. So when I woke up from the colonoscopy, and this physician that I had just met was telling me that I had what she thought would be pretty advanced cancer based off the size of the tumor that she found.
Chemo can slow down the progression of the disease, but eventually your body will stop tolerating it and the disease will spread.
I perfectly remember every single meeting with Kevin, every single meeting with Jess. One in the East Coast, the other one in the West Coast. People who are young in age, people who are healthy, and unfortunately they were diagnosed with colon cancer and advanced liver metastasis. The survival of patients like them, it's in the best series could be around 5 to 10% in 5 years.
It was very much going from this emotional high of having our 3rd child, healthy baby, to being diagnosed with some of the worst news that you can imagine.
My husband and I, we had 3 little girls at the time, and we decided that we needed to seek out all possible options. We reached out to doctors in the West Coast, in all parts of the United States. I think we ended up speaking with 7 or 8 different physicians, and pretty much all of them told us that there was nothing else that they could do for us, and that in fact I would just spend my remaining time on chemo.
My wife stumbled upon something called the Doc Talk. It was Dr. Hernandez from URMC, and he was talking about living donor liver transplants for colorectal cancer patients. And we watched that video together, and we said we should reach out to URMC. And within about 3 hours, we had an email directly from Dr. Hernandez.
And at the very bottom, he wrote, "Jessica, we can help you." And it was just that little bit of hope that my husband and I were looking for.
The first liver transplant for colorectal metastasis took place in the United States less than 7 years ago. We're one of the centers who started doing this. We have a national registry established here, so the University of Rochester is recognized as the epicenter for liver transplantation for colorectal liver metastasis. Kevin and Jess, both of them, when they were diagnosed, they were desperate looking for opportunities, and we were able to offer liver transplantation for them, where the opportunities of being alive at 5 years goes as high as 80%.
Traveling across the country, it was a little bit of a leap of faith, but at the same time, I didn't have a whole lot of options. My body was starting to break down.
Living in Maine, Rochester is about a 6 or 7 hour drive for us, but we were willing to follow Dr. Hernandez and get the best care.
Finding my donor was a crazy situation. My wife said that she wanted to do a video, and so she put out that video, and we got an incredible response. We had over 200 people call in the first 24 hours. I remember the team in Rochester saying that they had 2 really good candidates for transplant. And at that time, we didn't know who they were. Eventually, I found out that it was my cousin in Canada, Trevor, and he's a firefighter. And I said, stereotypical firefighter, like looking to help.
My brother's a police officer, I'm a nurse, and my sister's a teacher, and we're all public servants. My brother is obviously very courageous, and he wanted to be the first one to go through testing. When we finally found out that he was the donor, he received a call on December 17th. He immediately called me. I was very weak. It was hard to stand up without getting dizzy or seeing black spots. And so it just came at a really great time.
So I had the transplant surgery on May 24th, 2023. And when I woke up, it's a surreal feeling knowing that I didn't have disease in my body, You know, you first think of your family and what the future might hold. That feeling was incredible.
After surgery, they come in and they tell you that your liver has been taken out. All of the cancer has been removed. It's just unimaginable.
I ended up being in Rochester for about 3 months, a little bit longer than I think is typical for this type of procedure.
How are you?
Coming home, we didn't tell the kids. It was a surprise as I walked in the front door, and it was just the most unbelievable moment.
How are you?
I know that the story of Jessica, I know that the story of Kevin, it's out there in many other potential patients. For me, to see that is what gives me energy every day to come to work, to have challenges and to try to face them, to learn from them, and being able to help more patients. We want the University of Rochester Transplant Institute to be the destination for patients with colorectal liver metastasis for liver transplantation.
It's been just over 2 years since I had my transplant. I'm definitely feeling the healthiest and the strongest that I've felt since my diagnosis. It's a second chance on life. Along my entire journey, there's been moments or individuals or providers that have shaped the direction that things have gone. And no one more so than the team at URMC and Dr. Hernandez and my cousin Trevor, who was my donor. And I just could not be more thankful for how they've helped me get more time with my family.
4 years ago, I never dreamed that I would be where I am right now. My dad looked at me and he said, "Here I thought would be planning your funeral." I've had 2 extra Christmases with my kids. I've shared 9 birthdays with them. We've gone on many trips. I've watched hundreds of hockey games. And I'm so appreciative of Dr. Hernandez and Dr. Tomiyama and of course my brother and the whole team at Rochester, because if it weren't for them, I would not be where I am today. I'm so happy that they've given me this second chance at life.